Welcome, everyone. Thank you for joining us today to another YMCA Education Series talk. My name is Pam Rakanski. I am the YMCA Education Series facilitator here at the YMCA. Yay! It's my pleasure today to welcome Denise Schwartz. Yay! These are local physical therapists from the Manual Touch who will be talking to us about how to heal our shoulder pain naturally, heal your shoulder pain, and enjoy life again. This workshop is for you if you're having trouble sleeping on your arm, you have difficulty reaching overhead, opening the doors, or putting on your seatbelt. If you're unable to participate in the usual exercise of your choice, such as tennis, yoga, pickleball, or weightlifting. So she will be talking to us today. Today's talk is recorded, so it will be available as a podcast on our YMCA YouTube website later on, so you can reference it later or tell your friends about it. The YMCA Education Series program lasts about an hour. Denise will be taking questions towards the end of the talk, but if you have a burning question, feel free to put it into the chat box. We do check those periodically throughout the talk. All right, with that, we'll be welcoming Denise Schwartz from the Manual Touch. She is a licensed physical therapist who specializes in treating pain using a holistic approach to discover the root cause of pain and provide natural healing options. With that, please welcome Denise. Yay!
Hi, everyone. Just going to get this all set up here. There we go. I think you guys can all see me. Thank you, Pam. That was kind of getting that organized. And my mouse is still here, right? There we go. Okay, cool. All right. Well, hello, everyone. Good afternoon. Thank you for coming. And thank you, Pam, for having me again. I really enjoy doing these webinars. I think I've been doing one almost every month. And in the summer, we slow down a little bit. Today, we're going to talk about shoulder pain. And as Pam said, I am a physical therapist. I am the owner of the Manual Touch Physical Therapy in Wheeling. I'm right on Milwaukee Avenue near Dundee Road. So just outside of Northbrook, not too far from the Y. I've been doing this a really long time. I started my career at Lutheran General Hospital many, many years ago. And while I was there, I knew that back pain was the #1 reason people went to the doctor. So I took a lot of classes on treating back pain and became an expert in treating that. Along the way, I took many other classes to treat every other painful area in the body. Along the way, I started studying a non-traditional therapy called integrative manual therapy. This is a holistic body approach of using our hands and finding where in the body is preventing you from healing. What I found with this approach, which was very gentle, is those people that I couldn't help with my traditional physical therapy techniques, I could help them with this. So I then went on to work for the company here in the Chicago area. We had a clinic in Chicago and in Elmhurst and in Wheeling. And then in 2010, we parted ways. And what I realized is all the traditional stuff that I sort of gave up when I went to work for what was called Center IMT was still very valuable. So I now use a very whole body approach of using traditional and non-traditional techniques to get people back doing the things they love to do. About 20 years ago, I developed a love of running. So I took many classes and became a certified running coach and became an expert in treating runners. So I work with a lot of runners as well. I have a certification in applied functional science, and this is similar to the manual therapy, but this is about exercise and finding where in your body that's limiting you from moving appropriately, from using your body the way it's supposed to. So it's about really looking at you as a whole person. And in the last 4 or 5 years, I've added this new component called the OOV and the balance sit. And I'm going to talk about that later on at the end. Okay, this is my son. I'm doing a running in that, videotaping him running. So when I get runners in, we'll videotape them on the treadmill, and we'll take a look at what may be causing their issues while they're running. So today we're here to talk about shoulder pain. Maybe you have a goal, you're a kayaker, or here you can see, this is me. We were up in Alaska, this beautiful area, kayaking, and if you have shoulder pain, it could be a problem. Or maybe you want to play golf again, and right now it's limiting you. Or maybe you just want to have fun with your girlfriends. Or you could be like these three ladies who, when I did a half marathon down in Tampa called the Gasparilla Half Marathon, this was the day before, and these ladies already had a medal. I'm like, why do you have a medal? And it's because they walked the 5K, and then they were going to walk the 10K later that day, and then the next day they were walking the half marathon. So these ladies were really amazing. They aged from age 70 to 80. I think this is this woman's 80th birthday, as you can see. And then they had a huge goal of walking across America. And we just met standing in line at Starbucks. And we've kept in touch over the years, and they did complete that walk across America. They did it in 2 legs. In other words, they did, I don't know if it was like 3 or 4 months from Florida to mid-Texas. And then they came back a few months later and did mid-Texas to San Diego. So really quite something. And, you know, age isn't necessarily a limiting factor if you have a goal. If you want to be somebody like that, to really be able to age really gracefully and be able to continue to do all the things you love to do, a lot of the problems that people have are because on a daily basis, they don't really know how to move or sit or stand. So here's an ebook that I created that gives you tips for all those things that you do every day. So if you put your first and last name and your email in the chat box, I'll be happy to send this to you. Okay, so let's get to our topic. So we're talking about shoulder pain. And so when somebody comes in, these are often the complaints I hear when they have a shoulder problem. I can't lay on my shoulder. It wakes me up at night. Sometimes laying on supposed good side will hurt the other side. So sometimes you just can't lay on your side. I can't lift anything overhead. You know, I can't put dishes away. Difficulty getting dressed, washed, shaving, doing their hair, opening or closing doors, putting your hand in your back pocket, which would be similar to toileting, you know, cleaning yourself. Putting on a bra, those ladies, that's a big one. So usually you wind up having to change how you do that. We talk about difficulty reaching overhead, reaching behind your back. And then just like we're talking about, I can't do my favorite activity. I can't play tennis. I can't golf. I can't throw a ball. Even walking may aggravate it. Swimming, people might be a swimmer here. I know Pam's a swimmer. So it's very debilitating when you have shoulder pain. Today, we're going to talk about the most common causes of shoulder pain that I see in my clinic. Certainly, there are other issues at hand, but this is what we see most of the time. Tendonitis in the rotator cuff or the bicep tendon, which is what they also call it impingement. Also, a tear would fall into this. I'll have to add that on here. So a tear or a tendonitis of the rotator cuff or biceps tendon, and the impingement means that as you move your arm, the tendon actually gets caught at a certain point when you move your arm. The second most common cause is frozen shoulder, medically known as adhesive capsulitis, and then of course, arthritis. So let's talk about the shoulder joint. This is, if you're looking from the back, here is your spine, here's your rib cage, this is your scapula. I think some people call it a backbone, call your wing. And you can see the scapula is kind of a large triangular bone that comes here. It has a piece that comes out in the front, which connects to your collarbone, or known as your clavicle. And then your arm bone, your humerus, the long bone here, actually sits in the socket of the scapula. This is a ball and socket joint, also known as the glenohumeral joint, because this is the glenoid fossa that the humerus sits in. Excuse me, I'm going to sneeze. Sorry. Excuse me. Anyway, anybody sneezing a lot? There's a lot of allergies going around. At any rate, so this is the ball and socket joint. So, you know, you have the ball of the humerus sitting in that socket. So it is a pretty unstable joint, and it can move in all sorts of directions That's why it's a very sensitive joint, and when it gets to be there's an issue there, it's very limiting. And we'll talk about this a little bit later, but when you move your arm, this scapula moves in a special rhythm with the humerus. And what often happens is the reason that you get a problem or that impingement is because the muscles surrounding this scapula aren't doing its job. And so then when you go to raise your arm up, that scapula wings out or moves out too fast. Okay, and then things get jammed up in here. And you'll see that a little bit more later. Got this guy. Oh, there we go. So I put this in here to show you how everything is connected. So here, we got the dancing skeletons. He's got his arm over his head, but if his feet and his hips can't stabilize him and do what it needs to do, then this shoulder is going to suffer. So it's very important to look at everything to find out what may be causing this problem. Quite often, the problem is related to your core muscles. These are all the muscles below your diaphragm and above your pelvic floor muscles, okay? In the front and in the back. A big problem if somebody's had some surgery in here, could be a C-section, it could be gallbladder, could be just, a couple little pokes, or it could be a serious scar here. That scar tissue tightens things up in here. When you go to raise your arm, it's kind of like let's say you had a thread on a sweater and you pull on it down from the bottom and you go to raise up from the top, you'll feel it pulling through that whole system. So it's very important to look at that core. Quite often, when this isn't stable, strong, doesn't work together well with your arm, think of a baseball pitcher. I'm sure we've all seen a baseball game at somewhere along. And the power that they get is not from the little muscles around the shoulder. It's from these big muscles down in their butt, and then the energy transfer from their butt through their core up to their shoulder. So very, very important. All right, so let's get back to basic anatomy of the shoulder. So here we had from the back view. Here's the front view. Okay, so this is the scapula that would be, so here the rib cage is cut off. So if we're looking at someone from the front without a rib cage, that's what you would see here. Here's the humerus, here's the this component of the scapula that comes around called your acromion, and then this is where the clavicle joins. And so sometimes if you've ever had a problem, the doctor may say you have an AC joint issue, and that's this joint. Let's say you fall off your bicycle, you don't break the clavicle, but you might separate this joint. And so that gets irritated because there's ligaments that's holding that together. Over the bone is something called a capsule. Okay, and that's some cartilage or connective tissue that, that lubricates so the bones can move together. The thing that we hear the most about is the rotator cuff. Okay. All right. So here I wrote up what it is. I'm going to explain it on the next slide. So the rotator cuff is made of 4 muscles. The teres. So this is the back view again. You have 2 back ones called your teres minor. You have an infraspinatus, and then you have the supraspinatus here. And then coming from the inside, so here, sitting in front of here between the rib cage and the scapula is your subscapularis, and they all come and they all connect at this area on the bone. And it literally acts like a cuff that sits around that ball of the joint, and it holds it in place. So when you move your arm, that arm bone doesn't go straight up and jam right into here. Okay, so that's what the job of the rotator cuff is, primarily is to help stabilize the ball and the socket. so it stays in position. When there's a tear or a tendonitis there, we talked about how that rhythm gets thrown off and this rotator cuff can't function the way it needs to. Then this bone the humerus bone can move within the joint in a way it's not supposed to, and it will jam up like the tissues right here underneath these bones. Here's kind of a static slide showing you how the scapula moves with the humerus, okay? Here's the front view of the subscapularis sitting in between the rib cage, above the top part of the rotator cuff, the supraspinatus. And then here is your biceps. There are two heads of the biceps. That's why it's called bi. That means there's two muscle bellies. And this one comes up right into here in this groove in your shoulder, okay? And oftentimes this gets implicated. This becomes, gets inflamed along with the rotator cuff. Sometimes it's just rotator cuff, sometimes it's just biceps. Quite often it's both together. It's just another picture of the rotator cuff. We talked about the core and how important it is, and that diaphragm and breathing well. All right, another key component besides your core is your posture. So many people come in to see me and tell me I have terrible posture. And really, I don't think people have terrible posture. What happens is your body changes with time and age, and injury and weakness. And with those changes, all the tissues around your spine have to adapt. So if we looked at an ideal posture right here, you get a curve up in your neck inward, a curve out in the mid back, and a curve here in the low back. But as people, not even if they get older, I get, younger people and they're teenagers, whatever, can change. So you can get more rounded here. You could be leaning forward. It could get flatter here. Some people throw I see a lot, people throw their shoulder blades back in an attempt to stand up straighter, when that actually can set off problems into your shoulder. So let me see, I'm gonna see if I can see myself here. So if I raise my arm up, I'm pretty good there. If I were to sit really slumped, this is as far as my arm can go. Because remember, the shoulder is connected to this scapula here, which sits on your rib cage, which sits on your spine. So as your spine changes, if it curves forward or if it curves sideways, this scapula goes with it, and thus will change the mechanics going on in here. So it's really important for us to work on the muscles in your back, which makes up your core muscles, okay? So it affects how well you can move that arm. I want to go back to, I started to say how so many people talk about, sitting up really straight and pulling their shoulder blades back. And this is a very biomechanical thing, hard to visualize, but let's see if I can get a picture here. I'm back here, right here. So if you throw those shoulder blades way back like this, that will pull the humerus back a little too far. And so it won't have enough room to clear within the joint and roll back, and it'll jam. So overdoing back here is a problem. Rounding too much doesn't give it enough room to move. It's too much of a problem. So a lot of what we're working on is getting better scapular positioning and scapular control of those muscles. So the movement of the humeral head can move as cleanly as possible. A little example of, how we're just balancing one on top of bone on top of bone on top of muscle. And if one little piece isn't doing its optimal job, everything above it or everything below it can be a problem. So you come in with your shoulder, I'm going to look at your feet and your ankles, okay, and your hip and your back. If you come in to me with a foot problem, I'm going to look all the way up into that core and in your shoulders and your neck to see what's going on. So it's very important to look at everything. Hide myself again here. Okay. This is a very nice testimonial. A colleague of mine, a pediatric physical therapist, and those of you who've ever had to take a child to physical therapy know that the pediatric physical therapist it's a pretty demanding job because there's a lot of lifting and moving and crawling around and sitting on the ground to work with those kids. And so I've seen a lot of my colleagues come in who work with kids. And she was having some shoulder pain and doing some yoga, and it just was limiting her. And we got her back to doing everything she loves to do. Okay, so now let's talk about those 3 common causes. And as a reminder, if you also, this PowerPoint I can send you as well if you put your first and last name and your email in the chat box. I'll be happy to send you a copy of this PowerPoint with all this great information on it. Okay, so the most common thing I see is a rotator cuff tendonitis or impingement or a tear. And how we discern that, we ask you a bunch of questions, kind of figure out where does it hurt. Usually people will tell me it hurts at a certain point when they move their arm. So in other words, they might like, oh, it hurts here. And if I can make it through, oh, then it's not so bad from here to here. That means it's impinging at one point, you get through it and you're okay. Might hurt to lay on one side. We will find a weakness in the rotator cuff and usually, of course, the core and decreased scapulothoracic stability. Remember, we talked about that. The scapular muscles around scapula to stabilize so you can move your arm appropriately. I thought of something. Oh, and so what we need to do is really retrain how the arm moves with the scapula, and that we call neuromuscular re-education. Really reteaching your body how to move. The second most common cause is bicep tendonitis. And if you remember, that's that bicep tendon gets caught up in here in a groove in the humerus. And that what the complaints I hear with this is it hurts to put my hand in my back pocket. It hurts to pull up my pants, pulling up a blanket. So it's kind of this movement. And that's what this bicep does. Sometimes it'll hurt when you lean on your arm. And the telltale sign is if I put my finger there and I move your arm like this, and it's like, oh, that's really tender and it hurts. Quite often, the bicep tendonitis gets missed. So I had a woman come to me and she had been in PT the previous year for a frozen shoulder and was about 80% better, but not quite good enough. She heard my talk a number of years ago, and so she came in to see me. And by the time she saw me, she had had really a bicep tendonitis that either showed up later or was missed during her previous round of physical therapy. And so we focused on specific exercises to take care of that and got her better. She was able to put on a shirt without pain and pull up her pants again. So she was very happy. A very common diagnosis we'll see is a frozen shoulder known as adhesive capsulitis. And if you remember right, I mentioned this in the beginning, over that humeral head and covering the glenoid fossa is a connective tissue called a capsule. And it kind of protects the joint and it creates lubrication in there so it can move freely. And for some reason, we don't really know, adhesions develop in the joint and you literally get stuck. So you go to raise your arm and like, you can't go any further. Okay, and I can't get my arm back here. More often than not, people will tell me, my shoulder started to hurt a while ago, and then all of a sudden I just couldn't move it, got into terrible pain. And now it just hurts at the end range. So that's usually a pretty telltale sign that it's a frozen shoulder. Usually this will happen in people from the ages of 40 to 60. For some reason, it's more common in women than men. And then unfortunately, if you've had one episode of frozen shoulder, you might get it in the other one at some point. There are definitely stages to the frozen shoulder. Usually people start getting some really severe pain in their shoulder, and either before or after the severe pain starts, they're really not moving their arm much because it just hurts so bad. And it freezes up, and then it gets to a point where it plateaus, where it's not pain all the time, and it's not painful when you move it, but it hurts at the end range of their movement. So they may only be able to raise it this far, and that's where it hurts. But from here to here, it's okay, so not too bad. And eventually it goes through a thawing phase and you start getting your movement back. If you don't do anything, usually over a period of a couple of years, it will freeze on its own. If you come in for physical therapy, we definitely can shorten that time. In my practice over the years, I noticed there are two kinds of people. There are people who will get better pretty quickly with PT, like within 6 to 8 weeks. And then there's other people where it's a good 4 to 8 months. So I don't know why or who falls into those two categories. But we usually can tell within a couple of weeks of therapy who's going to be the quicker end or the longer end. All right. Then the last most common cause, which is really hard to work with, is arthritis. And if somebody really has a significant amount of arthritis, there isn't a whole lot we can do to help you beyond really learning how to move as best you can so not to aggravate that shoulder. Okay. Pushing you through to try to get more movement or to get stronger usually will just increase your pain. And it will persist too long. If you have an increase in pain after therapy for a couple of hours or the day, and then the next day it's okay, that's all right. But if it just gets to be a gnawing, aching pain for a few days afterwards, then it's too much. So we have to find the fine line between there. It's really about learning when it's really significant, particularly if it's bone on bone. It's really about managing the pain and learning how to function so as not to aggravate it. And that's where that ebook that I had in the beginning, learning how to move throughout your day and how to function, will help you out a lot. And then, of course, sometimes that shoulder pain that you have may not be coming from your shoulder. It may really be coming from your neck. So I had a woman come to see me early this year or last year. I can't remember now. 78 years old. She had had neck pain for many months, and she was seeing a chiropractor and a massage therapist for the 4 months. It didn't help at all, according to her. I'm sure she had up and down, but mostly it didn't help. Her doctor took an MRI of her neck, and it really was okay. It was typical degeneration for her age, but nothing significant enough for the amount of pain she had. She came in to see me. I taught her some movement and did some different kinds of treatments for her neck pain, which reduced within a couple of sessions. And then it became really apparent that it was really her shoulder that was the problem. Initially, when you have weakness in your arm or your shoulder, it could be coming from your neck or the shoulder. And so it was really unclear because she had so much neck pain. But once I kind of settled down and figured out what was really causing the neck pain, we could evaluate her clearly and realize she had a significant shoulder problem, rotator cuff tear going on. And what was happening is because the shoulder was probably getting weaker for whatever reason, she didn't realize that she was probably moving her irritating her neck every time she used her arm until it got so frozen, and sorry, that's a bad word, so stiff in here that her neck was worse than her shoulder, so she couldn't tell the difference. So it's really important. Two things from this. If you're seeing someone and you're to really heal up your pain and you're not getting better, or there's no change within even 4 to 6 weeks, then it's time to look at something different, see someone new. Very important. And then, you know, if I see someone and something's not get better, I'll refer them back to get some more testing and see what's going on. One time I had a woman had a pretty bad shoulder pain. She had a rotator cuff tear. I think she was in her definitely in her 70s. And by week 8, she just wasn't getting much better. I'm like, oh God, maybe you need surgery. And then she finally turned a corner. She started getting better. And to a point where she was pain-free. This woman, I happen to still know her because she's my brother's mother-in-law. So it's been 5, 6, 7 years. She hasn't had a problem with that shoulder. But there was a moment where it was 3, 4 months where it was touch and go, but we kind of kept at it because there were little things that were improving. So we kind of have to discern what's going on here. You know, when is it time to change and when is it time to make sure you're doing something different to get better? On my website, you can find this tip sheet. And if you give me your name and email, I will send you the tip sheet on how to take care of yourself, you know, how to open a door, how to put on a seatbelt. These are all little things that we do all day long that if we're not in our best position, can keep aggravating the shoulder. Okay, so how do we know physical therapy can help? It needs to be reproducible. In other words, you tell me, you know, at rest, I'm okay, but if I raise my arm and do blah, you know, try to do something, then it hurts. That's reproducible. If you come in my clinic and I test it and do various tests and we find a painful spot, then we can help it. If it's just pain and achy all the time, there's absolutely no position that you can get better in. And we can't quite reproduce it in the clinic. There's nothing specific about it. Then we will refer you back to your doctor to do some other tests because sometimes shoulder pain could be referred from something else more serious going on in your body. And we want to know what's happening. So the diagnosis really tells us what exercises you should do. There will be overlap between all the diagnoses, but some we won't do. For example, if it's a frozen shoulder, we're going to the point is to break apart those adhesions. If you have any of you have had a total knee, we have to cause pain to get that knee moving again. Same thing with a frozen shoulder. But if it's a rotator cuff tear, we don't want to push you through pain. So it's really important to know what's going on. And we usually can discern that with the exam. So what's the biggest mistake people make with shoulder pain? They ignore it. The sooner you take care of it, the better. When I was in Alaska, we saw glaciers. And here's one glacier. It's all the way back here. This sign, 2005, that's where the glacier was. It receded back there. You know, ignoring a problem that maybe we can do something about sooner than later before it gets out of control. That's me, actually. Okay, so you have 3 choices. You can ignore the pain. Maybe it'll go away, maybe it won't, but you'll develop compensation, and it will be harder to take care of down the line. You can alter it using medications, injections, or surgery. There's a place for this. Or we can handle it by coming in to get some physical therapy to learn how to use your arm appropriately, how to get stronger, how to really help that area heal naturally. Oftentimes, you might need an anti-inflammatory or a steroid shot coupled with the therapy. And sometimes you just need therapy. When you come in, you know, we evaluate you. We use a combination of hands-on work to make sure all the joints are in balance, reduce any soft tissue restrictions. And here at the Manual Touch, we'll use some non-traditional approaches as well as traditional. exercises to get you stronger, get the good mobility, get good stability, balance, exercises for your core, hips, and feet so you have a good stable base so you can move your arm. You get a lot of people, if their core is not strong enough, then you're moving your arm is kind of like just flapping in the wind on a very unstable, weak branch, okay? I mentioned this briefly, neuromuscular reeducation, teaching you how to use your body as a whole to get it all working together. Very, very important. And then a huge key is education. And it's a big part of my job is teaching you how to function. You know, as babies, we just all started moving and doing and getting up and walking. We sit, we stand, we bend over, we reach for things, walk. Nobody taught us how to do that the ideal and optimal way until something falls apart. I hear it all the time, particularly from my seniors. I have to relearn how to walk again because everything, and I should say everything, a lot of pieces are, wearing away. They're getting weaker as you get older. And so things aren't working together as well, and you have a problem. Here's a list of some of the things we're going to teach you how to do: sit, stand, walk, sleep, posture, lifting, and get you back to doing those things you love to do. Maybe we need to work on specific exercises for golf or for tennis or canoeing. Or just using your mouse. And a lot of people, their shoulder hurts, moving their mouse around. So we'll talk about that. Okay. If you remember in the beginning, I said I added a new tool to my practice called the OOV, and this is it. A friend of mine introduced this to me about just before the pandemic. So I guess we're 5 years now. It was 5 years ago. I felt like this is like the biggest game changer in my practice to teach people to re-educate people's bodies how to move optimally. The OOV works your body three-dimensionally so you cannot compensate. You learn how to use your core subconsciously like we're supposed to in everyday life. You can lay on your back. You can stand with it behind you. You can lay on your side. You can lay on your stomach. You can kneel on this. Here we're doing standing. Here you can see I have an older gentleman stepping over. Here's my son doing a much more advanced technique on one leg. I have my mother my 81-year-old mother laying on her stomach every morning because it's reducing her anxiety. Think about if those of you who might have anxiety or nervousness, that pit you get in your stomach, when you apply pressure there, it forces you to breathe and bring in your diaphragm, and it will relax your parasympathetic nervous system. So it works really well in that respect. During the pandemic, the creator of the OOV is an Australian osteopath and biomedical engineer. He created this. It's called a balance sit. You sit on this, looks kind of like a bedpan or a toilet seat. Okay, you sit back here. Okay, and we can have you do different things with your legs or your arms. And it gets you to sit up the way you're supposed to optimally. I've got people, I put them on there and they go and buy one right away. It's just like, oh, this feels great. However, you do not sit on this all day. This is a 10-minute thing, half hour at the most, couple times a day to get your core kicking into gear. You will get too sore otherwise. Okay, I think that's everything. As a thank you today, I'm willing to give you a phone call or a telehealth session to discuss anything that you might have going on and provide you with any recommendations. You can call my office at 847-541-7600. And my admin, Jenny, will call you back to set up a 20-minute consult to go over what's going on. In addition, remember to put your first and last name and your email in the chat box, and I will send you this PowerPoint and these ebooks. And thank you for being here today. Now, so what I'm going to do is going to close up the PowerPoint And if you have any questions, we'll answer those.
Awesome. Does anyone have any questions for Denise? I didn't see anything in the chat box.
Oh, okay. Any questions for me today? No? No? And no questions too stupid. You know, if you got a
I
question,
do.
someone,
I have
Right.
one.
Susan,
I'm
go for
trying
it.
to turn my video on, but I didn't do it. Sorry.
Okay.
I've had some rotator cuff discomfort that I have just rested and stopped sleeping on my arm, and it's gotten a lot better. There is a clicking sound at a certain point when I raise my arm. Do you know what that is? It's very minor. It doesn't hurt when it clicks. It just makes it's not really a popping sound, but a clicking sound.
You know, without saying it, it's hard to say, you know,
Sure.
clicking and crunchy noises could be probably more than likely it's like a tendon kind of moving within the joint, or there could be something impinged in there. It's not hurting you right now. However, you could be in a position that we need to kind of change. You know, maybe if you rounded your shoulders and then moved your arm, it was better, or if you bring your shoulder back. So we kind of have to play around with what might be going on. You know,
But
Susan,
that's not a common symptom.
no, actually it is. I probably should add that. So thanks for reminding me that. I do get that people are like, oh, did you feel that? Did you feel that? And
Yeah.
you know, sometimes I can feel it and sometimes you can't. It's a very, you know, internal thing. Yeah.
Okay. Thank you.
Good. Thank you. You're welcome.
Is there a chair you would recommend for daily use, like at a desk? Is another question.
You know, a desk chair that my patients who are working find helpful is a steel case. But they have a whole lot of models. It's kind of expensive, but you can find them used. My recommendation, I can't remember where they are. Look up a used office furniture place. I know there's a couple in the city and there's some scattered in different suburbs. And you should be able to find, you know, think about how many offices closed up shop in the last 4 years. There's lots of chairs to be found. And I got one at home on Facebook Marketplace, a steel case chair. But if you're very particular, you really want to test it out. You're looking for a chair that has multiple adjustments. So the seat, you want to be able to move up and down, maybe forward and back, the back forward and back, the arms, if it has arms up and down. You obviously need to go up and down and depending on where your desk is. So that seems to be, that's what you want to look for. There are other brands also. The cushioning, you know, think about like a Tempur-Pedic mattress. They'll put that in the seat cushion as well. So you need to kind of test them out to see what you like best. If you're working from home and all day long, you need a really good chair, and you should probably try to get your company to foot the bill, but you never know if they will. So. Oh, that's not what I wanted.
Any other questions? All right, you have Denise's information and everything. Feel free to contact her. Thank you again to Denise Schwartz for talking to us from the Manual Touch. Denise's next talk will be in July on running. So it's for runners healthy running at any age. If you have any people interested in running, we will be talking on July 25th at noon. Our next talk is next week. We have one on identity theft scams and elder financial exploitation on Thursday, May 23rd at 11 a.m. That is our next talk. All right. Well, thank you again to Denise Schwartz for talking to us today. This will be up on our website, on our YouTube library in a few hours. Look forward to talking to us in July. And thank you to everyone for coming on the call today.
Thank you so much for coming, and thank you for having me. Enjoy the nice weather. Have a good summer, everyone.
Thank you.
Have a good
Take
summer.
care. Keep moving.
Thank you.
Bye-bye. Thanks, Pam. Bye.